Okay, thank you, Stella. So we're very happy to join you this afternoon and share with the group some of the experiences so far of the SALURBAL study, which stands for Salud Urbana en América Latina, Urban Health in Latin America, which incorporates systems thinking and systems approaches as part of this international collaborative initiative to promote urban health and environmental sustainability in the cities of Latin America. So I'm going to introduce a little bit, how we think about systems in the context of the whole study, and then I will turn it over to Brent and Felipe, who will provide more detail on some of the things that we've been doing, and specifically the ways in which we have been engaging stakeholders and policymakers. So very briefly, this project is a wonderful project. It's an initiative of a network that we coordinate called the Urban Health Network for Latin America and the Caribbean, and it's coordinated out of Drexel University, the Urban Health Collaborative, but involves 14 partners, primarily based in Latin America, representing 11 different countries in the region, and it's funded by the Wellcome Trust. The overall arching goals of the study are three, really, to create an evidence base needed to make Latin American cities, and we hope other cities as well, healthier, more equitable, and environmentally sustainable, and importantly, to engage policymakers and the public in a due dialogue about urban health and urban sustainability and implications for societal action. And this is where I think the systems thinking is critically important, and you'll see how we weave it into the study over the course of this panel, and also to create a platform and a network that will ensure continued learning and translation into the future. We have 4 aims in the study, very briefly. The first aim is to identify city and neighborhood drivers of health and health inequities among and within cities. For this, we have compiled a very large data resource, pulling data from various sources. So this is really harmonizing and analyzing existing data. Aim 2 is a policy evaluation aim, where we are actually taking advantage of natural experiments and policy initiatives to evaluate health and environmental impacts. Aim 3 is our systems aim, which you will hear a lot more about, but it's really to employ systems thinking and simulation models to evaluate urban health environment links and plausible policy impacts. And Aim 4 is to engage broadly, not just the scientific community, but also the public and policymakers to disseminate and translate findings of the study. So as you can see, I wanted to highlight the fact that the systems approach is not the only thing that we're doing. And in fact, it's quite integrated within the rest of the study. And so really we think about 3 ways to obtain evidence relevant to urban health. One is through observation, our first aim. The second is through evaluation of experiments and actions. And the third is through systems modeling. And we really see these things as complementary in many ways. We have chosen 2 thematic areas for our systems approaches, and you'll hear Brent and Felipe will talk more about this, but we chose transportation policy and food policy. And the reason why we chose these 2 areas of emphasis for the systems modeling is, first of all, because they are both areas where feedbacks and dependencies, in the sense of people influencing each other through norms, for example, are critical. And they're also areas where there's a very strong health environment link, which may be, which may go both ways. The environment affects health, and people's behaviors also affect the environment. And so this makes the evaluation of the impact of transportation policies and food policies particularly amenable to systems approaches, because the effects of these policies will very likely involve reinforcing or buffering loops or dependencies. And also because these are areas that are of great policy relevance globally, but also regionally. In Latin America, there have been a number of innovative transportation policy and food policy initiatives, and so it's particularly well suited to our region. And also our team has experience in these areas. So I also just wanted to highlight briefly our fourth aim, which is about policymaker engagement. And this is, I think, unique. I mean, certainly for the research projects that I've been involved in, it's not common that we have an explicit policymaker engagement aim. And I think this is something that, to the Wellcome Trust's credit, this is something that they were extremely interested in. And, it is about ensuring policy relevance, of course, disseminating our findings, but also promoting new ways of thinking among policy actors and other stakeholders about the drivers of urban health and the types of policies and interventions that could improve health and sustainability in cities. And this is where I think certainly the systems approaches can yield very useful information in identifying policy and plausible policy impacts. But I think also, and I think you'll see this come through in some of the group participatory group model building that we did, it's really opening up the box a little bit and broadening people's thinking about what really drives urban health. And of course, advocating for and supporting the translation of research findings into policies and interventions. How have we engaged policymakers and other stakeholders? How are we engaging? Because this is really a work in progress, very much in progress. How have we engaged them in our systems aim? Well, first of all, we had a first stakeholder engagement activity, which is participatory group model building, implemented through 3 regional workshops, and Brent Langellier will talk about that. And then, of course, through other sources of information, including literature reviews and team expertise, we are developing 2 simulation models, one focused on transport and another focused on food policy, which Brent will also briefly review. And the goal is then to do a second stakeholder engagement activity, which we have not done yet because the models are still under development. And then in addition, these regional workshops also stimulated local applications of this participatory approach, several in fact, and Felipe will talk about one example, which is related to an evaluation that we're also doing as part of SALURBAL in Name 2 to evaluate a new transportation system, Transmicable, and they beautifully integrated some systems approaches into that evaluation process. So I think I'll turn it over. So the overview for today is to hear first from Brent on participatory group model building, and then also hear some brief outline of what our 2 models are looking like, and then hear in more detail from Felipe about the local policymaker engagement activity in Bogota. So I think I'll turn it over to Brent.
Thank you, Anna. That was a really great introduction. And I just want to start by reiterating something that Anna just went over, but this is our systems thinking aim. And I want to just make the point that when we talk about models and modeling, we're really using those terms very broadly. And we're thinking mostly about both mapping the system. So what does the system that influences urban health look like? What's the structure and how does that system function? And we're also talking about the formal quantitative simulation models and using those models of both types to really understand where are the opportunities for identifying high leverage policies. And I also want to just recognize that policymakers themselves, I think, are very willing to accept that cities and urban health are the result of complex systems. And there are various sort of aspects of complexity that are relevant for policy. So Anna mentioned feedback loops, interdependencies, and dynamic changes over time that are all important for policy. So in our experience, and I'll go over this more when I talk about the group model building, but I think policymakers are very willing to accept and understand, they have an intuitive sort of understanding of the fact that these systems are complex and these system structures are important for urban health and for policy. And part of what we need to do, and this is much of the work that we did in the first 2 years of the project, is identifying tools and a common terminology for describing complex systems and sort of taking those mental models and making them explicit. The main thing that we did in the first 2 years was this group model building workshops. And we did them in 3 cities with 62 policy stakeholders. And we're thinking of policy stakeholders as a pretty diverse group, right? So on the one hand, we've got academics, then we have elected and administrative policymakers. So these could be people in public health or planning agencies. And then we've also got NGOs that are really important for driving, especially local level policies in cities. So we looked at 2 different outcomes, healthy eating and mobility and transport in Latin American cities. And the objectives were several-fold, right? So we wanted to generally engage policy stakeholders in SALURBAL. Anna talked a lot about aim 4 and our policy stakeholder engagement. We really did do a nice job, I think, of integrating the system aim with that policymaker engagement. We also wanted to introduce systems thinking. So that's introducing these ideas of feedback loops, how to depict complex systems, and creating that common terminology that I touched on. We wanted to describe the structure and function of the systems that drive both healthy eating and transport, explore overlap between systems. So oftentimes in policymaking, people that are in food policy, for example, kind of only work in food policy, or people that work in transport are really urban planners that are mostly interested in, moving people across cities. But in fact, urban health is sort of at the confluence of these different sectors, right? So we're really interested in exploring these multi-sector influences. And then we wanted to sort of move towards identification of policy systems that really appreciate and incorporate the idea of health as the result of a complex system. So we did 3 workshops, one in Lima, one in Sao Paulo, one in Antigua, Guatemala. And these are some photos of various scripted activities that are really us working with the stakeholders to make their mental models explicit, to take what's in their minds and really be able to understand it and draw it out in an explicit way. So as I mentioned, group model building is, and I know that you had presentations from Peter Hauptmann and others that have gone into group model building. But again, this is a series of scripted activities that introduce systems thinking and work towards mapping systems. So the first one that we started with was graphs over time. And the purpose of this is to engage participants in framing a problem, initiating mapping, generating variables, and really thinking in a dynamic way, right? So the prompt that we used was for the healthy eating was think of a factor that influences healthy eating in cities. And I think this is the crucial part. Draw a trajectory that shows how you hope that factor changes over time and how you fear it will change over time. So we have that sort of, this is what I hope for trajectory. I hope that healthy eating goes up, hopefully. And I fear that it'll go down, right? And this is important because it gets you to think in a causal way, what are the factors that influence healthy eating? But it's also helping you to think in a dynamic way, right? It's really emphasizing that change over time. This is an example of a change over time graph. So another scripted activity that's highly important is causal loop diagrams. And I think you've seen some examples of causal loop diagrams, but the way that we drew these was in small groups, right? So the purpose of this scripted activity is to create and synthesize causal loop diagrams. So participants worked in groups of 3 or 4. They presented back to a larger group. So at the end of the activity, depending on the city, we had anywhere from 3 to 5 small group causal loop diagrams. Each small group presented back to the group and explained the variables and feedback loops that comprised their system. And then there was a synthesis activity where the small groups sort of worked together with facilitators to create a synthesis causal loop diagram. The prompt for this was build a causal loop diagram that explains a hypothesis of the food or transportation systems that influence a healthy urban environment. So this is really where we get to that mapping the system structure and function, right? Because we end this, this exercise with a whole bunch of small group causal loop diagrams, and we're beginning to work towards that synthesis model that takes into account the diverse perspectives and often overlapping perspectives of these 62 policy stakeholders. This is what it looks like. And at the end, you do get these pretty quickly, pretty complicated maps of these systems. And this is really an example, I think, of what I meant by policy stakeholders really do quickly accept that these systems are complex, that there are feedback loops, that there are multi-level influences. And so this is a set of tools for helping to convey that in an explicit way. And this is an example of the synthesis activity. So this is a guided script via which we work with the stakeholders to synthesize and unify sort of all of the small group causal loop diagrams. So this is an example of one of the initial causal loop diagrams that came out of one of the workshops in the cities. We then work over a series of sessions to sort of identify common variables and feedback loops and to unify and simplify the model. So this is what we ended up with. And I think there's a couple of sort of important things here, but one of these is that if you look at the lower left portion where the R4, R5, B4 feedback loops are, those are really related to healthy food consumption. If you look at the R1, R2, R3 in the upper right, those feedback loops are related to transport and mobility in cities. And we did not force sort of integration of these two ideas on the stakeholders. These are connections that they were very readily able to make themselves. And there were several sort of places related to both the physical environment and to time use that were sort of bridges between the food and the transport systems. So this really gets at that idea of multi-sectoral influences that I mentioned earlier. And then the last action idea, or the last scripted activity that I want to talk about is action ideas. And this is really a point of reflection, I think, for the stakeholders. We've now created the causal loop diagrams. We've talked about how the system is structured and how it functions. And in the action ideas script, participants really consider that. And they think, given this structure of the system, given these feedback loops, given the change over time that we want to see and what we're afraid of seeing, where can we make changes to the system? And changes to the system can be anything. They can be adding a variable or a feedback loop. They can be changing the level of a variable, or they could be, removing system structures like feedback loops in their entirety. And in the action ideas script, the stakeholders come up with these different policy interventions and they rank them on this two-dimensional scale of what's the easiest versus hardest to implement and what would have the lowest or the highest impact. And we come up with this sort of grid of interventions that that consider the structure of the system. And if you look in the bottom right, that's sort of the high impact, easy to do policy interventions. And these are things that policy stakeholders felt were very viable, like advocacy for food and transport, promoting cycling tours in cities, microcredit and credit systems for urban farming, right? So these are places where policy stakeholders really feel that there's a lot of bang for the buck. But then there's also other sort of harder to do, but also high impact policies like revising city master plans and design instruments. So that's about the group model building and the stakeholder engagement. And I think it was a really interesting process, both for us sort of learning about how stakeholders view the system, but also for growing that idea of urban systems as complex. And really beginning to engage stakeholders in both SALURBAL overall and in the systems aim. So as Anna mentioned, we then moved from sort of the stakeholder engagement piece into development of the formal models. The insight from stakeholders and the action ideas were an important input to that, but so were the knowledge of our team and literature reviews. But we did make two sort of formal simulation models, one of ultra-processed food purchasing and one of urban transport and mobility. And I'll just briefly overview these. So for the food purchasing model, the question that we're really seeking to address is how can food labeling, advertising, and taxation policies most effectively be combined to reduce purchasing of ultra-processed food in Latin American cities? And we're focusing on those policies in particular because there's so much policy action right now in Latin American countries and cities based on those. So there have been really prominent examples of taxation, labeling, and advertising policies in specific Latin American places, but also other countries and cities many of them are considering adopting these. So this is really a case of us wanting to strike while the iron is hot. And the second question is, do policy effects vary across different population segments? And we're particularly interested in socioeconomic inequities. So the model is comprised of adult females that are living in urban areas in Latin America that are the primary food purchasers in their households. Population demographics and food purchasing data are from Mexico City, but we could plug in data from any other urban area in Latin America. So it's a very flexible framework. And agents are organized in social networks. So we see social influence and social norms as being really important for driving these dietary behaviors and potentially important for policies that are seeking to shrink inequities, right? So we want to account for the interdependencies between people explicitly in the model. As the model runs, ultra-processed food purchasing is updated based on changes in policies. So we run these policy counterfactuals where we implement labeling and advertising and price policies, and also based on social norms and social influence. So what I do, the level of ultra-processed food that I purchase, is impacted by the purchasing behavior of the people that look like me and the people to whom I'm connected. And the policy effects are based on price elasticities from Latin American countries. So that's price changes relative to income. Advertising elasticities that are from meta-analysis, and labeling that's based on a Chilean policy evaluation, which was the first country to pass comprehensive stoplight labeling policies in Latin America. So that's a little bit about the structure of the model. And I just want to briefly touch on the utility of the model. So as I said, these types of policies are under consideration in several countries, and policy effects are likely to vary in different contexts if policies are implemented in different levels or combinations. So higher or lower taxes and labeling, or just taxes alone. And we think the industry will respond with advertising. We have a whole history of industries vastly increasing advertising and lobbying efforts in ways that both impact whether a policy gets passed, but also its effects, right? So if advertisements increase, that can really sort of mess with our ability to use quasi-experiments, for example, to evaluate the effects of a policy, because we have those concurrent changes in advertising that are hard to control away. And critically, I think for both of these models, we're developing model infrastructure. So we can quickly change the parameters related to both the city and the tax or policy levels as new policies are considered by cities. So we see this as not just as sort of what would happen in Mexico if they implemented these policies, but also as an urban food policy lab that will enable us to be more responsive in the future to policy proposals. The second model is an urban transport and mobility policy. So commuter decision-making and behavior is modeled in a Bogota-inspired city. So there's 5 commute modes: car, bike, bus rapid transit, and motorcycle and walking. And we're trying to explore the impact of public transportation policies, taxation, and interventions to improve personal safety from crime on the mode share of each of those modes and physical activity and air pollution. Again, this is about interconnections between behavior, health, and the environment. This is a spatially explicit model that really accounts for both residential segregation in a city, income inequality, and commutes between homes and workplaces. So it's based on a very realistic spatial environment. And there are important aspects of design that are related to those inequities. So car, motorcycle, and bicycle ownership vary a lot by income. Bus and BRT stops are realistically distributed through the city. And each mode is assigned a safety value based on available crime data. There are daily commute to work decisions that each agent in the model makes. So if you don't own a car, for example, you can't take a car to work. And every agent evaluates the perceived safety of each mode and avoids modes that it considers too unsafe based on that agent's threshold for safety. And basically they calculate a utility based on the travel time and cost of each mode, and they just choose the mode with the highest utility. So that's a pretty high-level overview of the two models that we've made. But I just want to make the point that I think that, again, these are really important for establishing infrastructure to look at specific policies so that we can take advantage of timely policy proposals that are under consideration. And I think both models do a really nice job of sort of integrating the health aspect that we're very interested in with outcomes that are also interesting to policymakers and to other sort of people that work in policy across multiple sectors. So I think that that's a high level overview of what we're doing. And I'm now happy to turn it over to Felipe, who's going to talk about a specific effort in Bogota.
Thank you, Brent and Anna. So now I'm going to talk about Transmicable. Transmicable is a case study that we have conducted here in Bogota, and it's about the implementation of a cable car in one of the most poorest areas and dense areas of Bogota. Ciudad Bolivar, which is the area, is 1 million or more inhabitants live there. And this intervention has allowed them to go and have faster trips and journeys for working and also for during their days. The Transmicable was implemented in 2018, and in the first year, it has more than 7,500,000 passengers. So our objective was to evaluate that intervention and the impact in health. So the Transmicable was not only the cable car, but it was about the implementation of 16 urban projects, which include facilities for recreation and cultural activities, physical improvement to homes, tourism offices, local market venues, community centers, etc. So to take into account all of these interventions and social urbanism changes into the community health, what we looked at was to assess the environmental and social determinants of health attributable to the intervention, the physical activity for leisure and also for transport effect, and also health outcomes such as quality of life, respiratory diseases, and homicides. Also, we looked at the pollution, and what was very important in this evaluation is to use citizen science also to identify, prioritize, and communicate to the community and to the policymakers the negative or the barriers and the facilitators of this intervention for promoting health to the community. And these methodologies allowed us also to empower the community and increase their adoption, and so they could take care of the cable cars and of the interventions they had. So the first step of the project was to create the conceptual framework that enabled us to identify the different dimensions that we could take into account for the evaluation and for the instruments. So for that purpose, we conducted a workshop, a group model building workshop with the activities that Brent just told you, with 31 stakeholders from different sectors of the government, and also we invited community members and persons from the academia. So the idea of this workshop was to develop a causal loop diagrams that enabled us to understand the structure and function of the system with the main question of what is the expected effect of transmicable intervention in the health of the community. So with the input of these stakeholders, we conducted the activities. We divided them in 4 groups, which were composed of intersectorial groups. We had persons from, for example, the Secretary of the Women, persons from the National Institute of Health of Colombia, persons of the Health Secretary, of the Secretary of Social Integration, of the Recreation and Sports Office, also from the Housing Secretary. And with that in mind, what we obtained with those persons was this causal loop diagram. So at the beginning, it looked a little bit confusing and messy, but when we started to look at the diagram, we could make an iterative process with them and to start understanding which were the constructs and the cause-effect relations that they identified. So for that, what was very important also was to conduct a second, not workshop, but surveys or more than surveys, interviews with them. So we met with them, we communicate to them the final causal loop diagram of the workshop in one-to-one interviews, and we could have some feedback from them to understand and to clarify the terminology and to refine a new diagram. So after that second activity, what we have was this diagram that you observe in the right part of the screen. So we could here identify clear feedback loops and dimensions of the effect of transmicable in health. So we had the health conditions. There were also concerned about the quality of the service and the operationalization of the intervention of the service. Also about the citizens' culture and the social and economic development of the area. So concerning the health conditions, the variables that were embedded and the relations, what showed us that was that concern about how social dynamics could favor physical activity promotion and the dynamics of transport for mental health and leisure activities, because this intervention could provide more free time to persons, so they could do this kind of activities. The second domain of social and economic development, we have these social dynamics that could have an impact on mobility, interurban displacement, and quality of life. With this domain, what we did, for example, during the evaluation was to provide to a sample of persons a mobile phone app so we could track their movements. And we are now having a lot of information on how this intervention could improve their mobility in terms of time and in terms also of the quality of their trips. Also, the citizens' culture was part of this construct here, this dimension, was about the community appropriation of the intervention, which is very important because this is an area that is violent, where there could be vandalism, gender-based violence. So how the community is getting involved with the intervention and they feel it belongs to them and they will take care of it. So, and also we have this final domain, which was about the operationalization of transmicable, which is more about the provision of an efficient service, which could be measured with the satisfaction instrument of the service. So some reflections about this activity. And this part was the first that we could, by incorporating these different stakeholders to have an overview and a shared mental model of the system, we could find 4 domains that were not evident before that, only for us as researchers. The second thing is that by inviting policymakers to the co-creation of this framework, we could have a lot of support after that to conduct the evaluation and also to make the results of the evaluation visible for the community and also for the city. Now, the new major is implementing the second cable car in the control group, in the control area that we choose. So this is a very good news for the city, and there is a lot of lessons learned from the community and from the policymakers to be applied in this second intervention. And also, a lesson learned to finish is that the community, by inviting also the community to those processes with policymakers, we are cutting a distance that seems very, very far between both of them. And here, by integrating everyone in the same room with the same roles and with the same, let's say, power or voice opportunities to be heard, there is a shared mental model that comes from different hierarchies of complexity that could be simplified into a single instrument, which is a causal loop diagram. So we can incorporate different point of views. And this has been very useful because now the community representative, the person that represents the community adopted that model for them and for considering how the intervention is developing in their lives. So this is what I had from my side.